There are days when your head feels a little heavy, your vision blurs for a few seconds, or you feel a bit lightheaded when standing up. Many people brush it off as just a sign of getting older. But as a doctor who specializes in stroke and brain blood vessels, I want to give you a serious warning. Those small signs could be the quiet knock of a brain aneurysm getting ready to rupture. It's like a door about to fall, it gives no real warning. And when it comes down, everything can change in an instant. In today's video, I'm going to show you four early warning signs of aneurysms and strokes that 90% of patients ignore, and 3 simple tests you can do at home to check your risk. I don't want you to live in fear. I want you to understand how your brain works and take control of your health before something serious happens. Because when you recognize the signs in time, you can prevent a major medical emergency. Before you can protect yourself from one of the most dangerous medical emergencies, a stroke, you need to understand what's really happening inside your brain when a stroke strikes. Imagine your brain as a highly sophisticated command center, constantly powered by a steady stream of oxygen and nutrient-rich blood. But when that supply is interrupted, even for just a few minutes, the results can be devastating. There are 2 main types of stroke. The most common is an ischemic stroke, which happens when a blood clot blocks the flow of blood in an artery in the brain, similar to a clogged pipe in your home. Blood flow stops, oxygen can't reach brain tissue, and brain cells begin to die within minutes. The second type is a hemorrhagic stroke, which occurs when a blood vessel in the brain bursts, allowing blood to leak into the surrounding tissue. Instead of being blocked, the blood flows where it shouldn't, damaging healthy brain cells and increasing pressure inside the skull. Both types of stroke can be fatal or leave lasting disabilities if not treated quickly. There's also a critical warning that many people overlook: a transient ischemic attack, or TIA. Because the symptoms usually go away within minutes or hours, it's often dismissed. But make no mistake, a TIA is like a fire alarm. It's your body's urgent warning that a full-blown stroke could be just around the corner. The truth is, strokes don't usually strike out of nowhere like a bolt of lightning. Instead, they build up quietly over time. Uncontrolled high blood pressure, long-term diabetes, smoking, and chronic inflammation in the blood vessels all slowly damage the inner lining of your arteries. This leads to narrowing and blockages that raise your risk of stroke. In the case of a hemorrhagic stroke, the danger comes from something more hidden: weak or damaged blood vessel walls. After years of high blood pressure and aging, these vessels can become fragile. Sometimes a vessel even bulges out into what's called an aneurysm, a small balloon-like pouch. Imagine a thin spot on a bike tire that keeps swelling. One sudden change in pressure and it could burst. If that happens in the brain, blood spills into the space around it, causing a subarachnoid hemorrhage, a life-threatening emergency that can lead to coma or even death in seconds. Brain aneurysms. A hidden threat. Most people don't even know they have a brain aneurysm. A hidden danger that many people are completely unaware of often forms at junction points where different arteries in the brain branch off. These areas are structurally weaker, and over time, the constant pressure of blood flow can cause them to bulge like a weak spot in a garden hose. That's where an aneurysm can silently form and grow. According to medical statistics in the United States, millions of Americans are living with unruptured brain aneurysms without knowing it. Some studies estimate that 1 in 50 people may have one. That's around 6 to 7 million people across the country. Notably, women are affected more often than men. The surprising part, most of these aneurysms never cause symptoms and remain harmless for life. Many people live full, healthy lives without ever knowing they had one. But the real danger begins when an aneurysm ruptures. When that happens, it's not just a small event, it's a medical emergency, like a tiny explosion inside the brain. The symptoms can appear suddenly and be severe. In addition to typical stroke symptoms such as numbness or weakness on one side of the body, a ruptured aneurysm may also cause alarming signs like blurry or lost vision, one enlarged pupil that doesn't react normally, a sudden severe headache often described as the worst headache of my life. In some cases, just a vague feeling of exhaustion, nausea, or unexplained dizziness. Do not ignore these signs, not even for a second. If you or someone near you experiences any of these symptoms, take action immediately. Call 911. Without delay. When it comes to strokes or ruptured aneurysms, every minute counts. Acting fast can mean the difference between life and death or permanent disability. So, what can we do to lower the risk? The answer lies in being proactive. The American Heart Association and the American Stroke Association have shared clear science-backed guidance, especially for those entering middle age and beyond. Everyone is at risk, and that risk increases with age, especially if you have conditions like high blood pressure, diabetes, high cholesterol, or a history of smoking. But here's the good news. These risks can be managed and often reduced by taking control of your health. That means properly managing underlying conditions, adopting healthy lifestyle habits, and staying on top of routine checkups. Taking action today is how you protect yourself and your loved ones from a crisis tomorrow. If you truly want to lower your risk of stroke and protect your brain as you age, here are some key principles you don't want to overlook. First, find out where you stand. Are you in a low-risk or high-risk group? Knowing this isn't just informative, it's motivating. It helps you take ownership of your health and make stronger, more committed lifestyle changes. Don't hesitate to talk with your doctor. They can use stroke risk assessment tools developed by the American Stroke Association to help you get a clear picture. These tools consider factors like blood pressure, diabetes, smoking habits, and your medical history to give you a better understanding of your overall risk. When you know what you're facing, you can build a better plan to protect yourself. And don't underestimate the power of a healthy diet. A balanced diet, rich in leafy greens, fresh fruits, whole grains, fiber, and heart-healthy fats from sources like fish, avocados, and olive oil can make a big difference. It not only helps you maintain a healthy weight, but also supports your heart and reduces the strain on your brain. If you're not sure where to start, I've created separate videos focused on smart age, appropriate nutrition to help you build a meal plan that fits your needs and lifestyle. Next up, physical activity. And no, you don't have to be an athlete, but staying physically active on a regular basis is absolutely essential. The American Heart Association recommends at least 150 minutes of moderate exercise per week. That's as simple as a brisk 30-minute walk 5 days a week. If you enjoy more vigorous activities like biking, swimming, or playing sports, just 75 minutes a week can be enough to keep your heart strong and blood flowing smoothly, which helps protect the blood vessels in your brain. Weight management also matters a lot. Maintaining a healthy weight is key. Excess weight and obesity are major contributors to stroke, diabetes, high blood pressure, and heart disease. Unfortunately, obesity rates among adults in the US, especially older adults, are still rising. But you can change that trend for yourself. Start with small steps. Cut back on added sugars. Watch your portion sizes. Move your body more often. These small changes can lead to big improvements over time. And let's talk about smoking again. Smoking is one of the most dangerous habits for your blood vessels. If you currently smoke, talk to your doctor about ways to quit safely and effectively. And if you live with someone who smokes, remember secondhand, smoke can damage your blood vessels just as much. Don't ignore the risks, they're real and they're serious. Finally, managing chronic conditions is critical. This includes regular blood pressure checks, keeping your blood sugar under control if you have diabetes, working with your doctor to manage high cholesterol, and addressing conditions like gout if present. If these conditions aren't properly managed, they can quietly damage your blood vessels over time, making them more prone to blockages, rupture, or weakening. And remember, taking your medication as prescribed is non-negotiable. Don't stop, reduce, or change your dosage just because you feel better. That feeling can be misleading. The underlying risk may still be there. And finally, take charge of your health journey. The last point, perhaps the foundation of everything we've talked about, is this. You need to be proactive about your own health. Don't wait until symptoms appear to start making changes. Start now. By educating yourself, watching videos like this one, listening to your body, and most importantly, keeping an open line of communication with your doctor. Even a simple question like, "I'd like to understand my stroke risk. What can I do to prevent it?" can open the door to early detection and meaningful lifestyle changes. What about screening? This is a common concern. Many people wonder whether they should get a carotid artery ultrasound, which checks for narrowing or blockages in the major blood vessels on either side of your neck that carry blood to the brain. Technically, yes, this test is available, but according to current guidelines from the American Heart Association routine, screening with carotid ultrasound is not recommended for people who don't have symptoms or specific risk factors because the overall benefit is unclear in those cases. And what about CT or MRI scans to look for brain aneurysms? This is another source of anxiety, especially for those who've heard tragic stories about ruptured aneurysms. While modern imaging tools like CT and MRI can detect aneurysms, they are not recommended for routine use in the general population. They are typically advised only in certain high-risk cases, such as if you have 2 or more first-degree relatives, a parent, sibling, or child who've had a brain aneurysm. If you've personally had a subarachnoid hemorrhage due to a ruptured aneurysm. If you've been diagnosed with rare genetic conditions like Ehlers-Danlos syndrome or polycystic kidney disease, both of which can weaken blood vessel walls and increase the risk of aneurysms. In these cases, your doctor may recommend periodic brain MRIs to monitor your risk. If you don't have any of the high-risk factors mentioned earlier, then routine screening for brain aneurysms is not recommended. That's because most unruptured aneurysms don't cause any symptoms, and in the vast majority of cases, they never become a real threat. In fact, discovering an aneurysm by chance can sometimes lead to unnecessary anxiety or even unneeded medical procedures. To sum it all up, understanding your personal risk-taking, early action, maintaining a healthy lifestyle, and having open conversations with your doctor, that's the most reliable path to protect your brain and reduce your risk of stroke as you age. Stroke doesn't usually come out of nowhere. It's often the result of years of silent damage to blood vessels. It remains one of the leading causes of death and long-term disability, affecting movement, speech memory, and overall quality of life. Whether caused by a blockage or a rupture, the good news is that most strokes are preventable with proper care and lifestyle changes. One of the most dangerous forms is a ruptured brain aneurysm, which is a true medical emergency with serious consequences. But the encouraging truth is many of the risks are manageable if you commit to building a healthier routine. That means eating a balanced diet rich in vegetables and fruits, staying active, avoiding tobacco, maintaining a healthy weight, and keeping a close eye on chronic conditions like high blood pressure, diabetes, and high cholesterol. If you found this video helpful, please hit the like button and subscribe so you won't miss future videos on brain health, heart care, and disease prevention. And don't forget to share this video with your loved ones, because one small action today could help someone avoid a life-changing stroke tomorrow. Before you go, I'd really love to hear from you. This week, what's one thing you'll do to take care of your brain health? Leave a comment down below. I read every single one and will respond to some of them in upcoming videos. Thank you so much for watching all the way to the end. I'll see you in the next video. Until then, stay proactive. Keep learning and take good care of your body and your brain every day.